Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with kidney and bladder ailments that start with the letter I. But before I do this, I wanted to let you know that because I have a great many video topics, I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney and bladder. Then ailments specific to women and specific to men. Then issues of the hormones and the metabolism. After that, I'll address the issues of homeopathic remedies on infections, infestations, and the immune system. Then issues surrounding fertility, pregnancy, childbirth, and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. Those are people that react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. And as an example, nature-mirror people tend to be pear-shaped, have dark complexions, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of stooped appearance, with an anxious expression and a craving for sweets, and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let's continue with learning how homeopathic treatments can help with kidney and bladder ailments, starting with the letter I. In the average adult, the kidneys filter the total volume of the blood nearly 300 times a day, producing about 1 liter or 2 pints of urine, passed on 4 to 6 occasions. As urine is produced, it filters into collecting ducts in the neck of the kidneys and trickles down the ureters into the bladder. As soon as the bladder is half full, its total capacity is about 1 pint. Stretch receptors in its wall signal the urge to urinate. After the age of about 4, the sphincter between the bladder and urethra is under voluntary control. The male urethra, which acts as a passageway for semen as well as urine, is nearly 4 times as long as the female. This, and the fact that its opening at the tip of the penis is well removed from the anus, explains why men are less susceptible to urinary infections than women. Unfortunately, the short female urethra provides bacteria with a relatively swift invasion route to the bladder. Urine, the sterile product of the non-stop filtering activities of the kidneys, is 96% water and 4% organic and inorganic solids, and its color can be a valuable guide not only to the functioning of the kidneys, but also the state of the liver and gallbladder. The kidneys regulate the amount of water and also the balance of acid and alkaline constituents in the blood, and on these two things all the chemical functions of the body ultimately depend. Inside each kidney, the branches of the renal artery subdivide into 1 million or so tiny tufts of blood vessels called glomeruli. Small molecules, such as water, salt, various minerals, glucose, and wastes, such as urea, which is a product of protein breakdown, squeeze through their walls under pressure and enter 1 million adjacent tubules called nephrons, which selectively reabsorb them. In a healthy kidney, 99% of the water and all the glucose are reabsorbed. This reabsorption process is controlled by hormones made in the pituitary gland at the base of the brain and in the adrenal glands that sit on top of the kidneys. The kidneys themselves produce a number of hormones that help to control blood pressure, stimulate production of red blood cells in the bone marrow, and activate vitamin D. Incontinence of urine. Involuntary urination can be due to weakness of the pelvic floor or prolapse of the uterus. Leakage of urine when sneezing, coughing, laughing, running, lifting things, and so forth. With dragging pain between the legs. C. Stress incontinence, uterus problems, irritable bladder, sudden uncontrollable urge to urinate, prostate problems, which is signaled by urgency and frequent dribbling after the flow has stopped, or bladder and urethra infections, which are characterized by urgency, frequency, scalding pain upon passing urine, having to get up at the night. See cystitis, or the result of injury. Injury to kidneys, bladder, or urethra, lower abdominal surgery can also cause temporary loss of control. Urinary incontinence can also be part of senile dementia. It may also occur during an epileptic fit. Suitable homeopathic remedies are listed under each of the conditions mentioned. If loss of control is accompanied by sudden weakness, confusion, dizziness, numbness, paralysis, or great heaviness in any part of the body, blurred vision, slurred or difficult speech, or loss of consciousness, see a doctor in 2 hours, since a stroke may have occurred. If after an accident of some kind there is weakness, numbness, paralysis, and loss of bowel as well as bladder control, spinal cord injury should be suspected. Call 911 and give Arnica 30C every 5 minutes for up to 10 doses until help arrives. Hypercarium 30C, given 4 times daily for up to 7 days, will aid recovery. Self-help. The best way of toning up weak pelvic floor muscles, especially after childbirth, is to practice stopping and starting the flow of urine several times while urinating. Standing, tucking the coccyx in, and tightening the muscles around the anus has a similar toning effect. In elderly people, problems can be minimized by establishing a regular pattern of urination. Use an alarm clock if necessary and set it to go off every 2 to 3 hours. Bedtime drinks should be kept to a minimum. If there is a problem getting to the toilet quickly, use a chamber pot or a commode. Injury to the kidneys, bladder, or urethra. Kidney injuries, usually caused by a blow under the ribs or a crushing injury to the rib cage or upper abdomen. Injury may merely bruise the kidneys and ureters. More seriously, it may rupture them, releasing urine into the abdominal cavity and causing peritonitis. Most kidney injuries declare themselves by blood in the urine. Rupture causes severe back pain in kidney area, made worse by pressure and movement, plus the symptoms of peritonitis, which are nausea, vomiting, distended abdomen, fever. The appropriate action is to call 911 and give aconite 30C every 5 minutes until help arrives. If the kidney is damaged beyond repair, it may need to be removed. If the kidney is merely bruised, recovery takes about 7 to 10 days. Specific remedy to be taken every 2 hours for up to 2 days during recovery from injury. Arnica 30C. Bladder and urethra injuries. Most bladder injuries are caused by blows that fracture the pelvis and cause splinters of bones to puncture the bladder. In addition to severe pain in the lower abdomen, blood in urine, and inability to urinate, urine may seep into the abdominal cavity and cause peritonitis, or the person may go into shock. In men, the urethra can be ruptured by a straddling fall or a blow to the groin. As well as agonizing pain, there may be subsequent difficulty urinating and narrowing of the urethra as the injury heals. See urethral stricture. Urethral injuries in women are rare. If rupture of either urethra or bladder is suspected, call 911 and give aconite 30C every 5 minutes until help arrives. If urination is still possible, even if scanty or painful, give one or the other of the remedies below. But if blood appears in the urine or retention of urine sets in, see a doctor in 2 hours. Specific remedies to be given every half hour for up to 10 doses immediately after injury. Injury involves bruising only. Use Arnica 30C. Very scanty amounts of urine passed. Use Opium 6C. If injury leads to cystitis, take Staphysagria 6C every 2 hours for up to 10 doses. Irritable bladder. Sudden contraction of the bladder causing instant urge to pass urine regardless of time or place, often associated with stress incontinence or prolapse of the uterus, in which the pelvic floor muscles are weak, or with urinary tract infections such as cystitis. Frequency, burning sensation upon passing urine. The orthodox treatment depends on the cause, but if nervous control is faulty, drugs may be prescribed to suppress nervous impulses to bladder or relax the bladder muscles. For homeopathic treatment, look up whichever of the above conditions is most appropriate in my videos. If none of the remedies mentioned seem suitable, select one from the list below. Specific remedies to be taken every 4 hours for up to 7 days. Great urge to pass urine, but nothing comes. Chilliness and irritability. Use Nux 6C. Non-stop urge to pass urine. Straining produces only a few drops at a time. Burning pain at the neck of the bladder and in urethra, especially in older women. Use Copaiva 6C. That's Copaiva 6C. Involuntary passage of urine when coughing or sneezing. Use Causticum 6C. Involuntary passage of urine upon sitting down, walking, coughing, or passing wind. Pulsatilla 6C. Self-help. See stress incontinence for exercises to strengthen the pelvic floor muscles. Nervous control of bladder muscles may also be improved by not instantly answering the urge to urinate, but holding on for as long as possible. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.